Hi, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. Welcome to the preview of our October issue. The cover story this month takes a look at the challenges hospitals face in collecting, analyzing, and sending hospital quality metrics to payers. Managing Editor Bill Santamore takes a closer look.
This month's cover story is about the pressure that hospitals are under to collect data about the quality of care delivered in their organization. What we found is that there's a big disconnect between what's now measured, what should be measured to improve quality in the long run, how it's collected, and how quickly it's collected. For instance, we know that computers are good at collecting data, but they're not good at interpreting exactly what needs to be collected as human clinician, people with clinical knowledge would be able to do. Doctors don't always record information in the same way, so you need the ability to interpret sometimes what they've written in the medical record. Hospitals can't solve the situation by themselves or entirely on their own, but there are certain things they can do. For instance, they can educate physicians on why it's important to collect exactly this kind of data as opposed to that kind of data and how they record it. They also can investigate the different kinds of technology that can be used to collect data, and they can pinpoint exactly when in the process data should be collected and analyzed. Collecting data isn't that complicated, but collecting the right kind of data at the right time and getting it reported in real time is what's complicated.
Next up is Hayden Bush, who talks to us about the second in his three-part series focusing on healthcare's costliest 1%.
So this month I'm doing the second part in my three-part series on high utilizers of care that we're calling the 1%ers. And this time we're focusing intensely in on folks with chronic conditions. There's some recent statistics out that show that about 75% of all healthcare costs relate back to chronic conditions. So we're taking a look at some of the work that a lot of early adopter hospitals have done to not only treat people in the hospital and have better referral systems for folks with chronic conditions, but also reach out to them in the community before they end up in the ED or in a hospital bed. And typically a lot of this work has been done with hospitals with high uninsured populations, but as the penalties for readmissions start to mount and a lot of folks switch over to accountable care organizations or other arrangements that are more value-based than volume-based, there's a bigger array of providers that are interested in this population. My final piece in this series, which is going to be in the November issue of H&HN, is going to look at some of the work in the Medicare and Medicaid populations to better treat folks with high costs.
Staff writer Marty Stepniak takes a look at a special section we've done on reducing errors in the operating room.
So the October gatefold deals with the issue of patient safety in the operating room. Even though this is something that's been talked about a lot in hospitals, still some of these seemingly avoidable mistakes are happening a lot. Wrong site surgery or operating on the wrong patient. So the gatefold explores ways for hospitals to avoid these mistakes. Some of the biggest surgery experts in the country have advocated for using surgical checklists, sort of taking it a step at a time like you're an airline pilot and checking off steps along the way. And we include other ways for hospitals to implement the checklist, who should be on your team that's going to start implementing it. In South Carolina, where there's been a big push to use the checklist, already 35 hospitals are using it, and they estimate that with full implementation, they could save about 500 lives a year.
And finally, I interviewed Dr. George Bolin, who is heading up a 10-year, $500 million initiative to take a look at improving patient engagement. So that's a look at the October issue of H&HN. Thanks for tuning in.